I think, when we look at the NCDs at the UN meeting, it's a historic event. I believe it's also historic for the Caribbean, CARICOM group that really pushed this from the Port of Spain Declaration all the way to the Aruba Call to Action, which I formed part of, that got taken in to the Millennium Goals. I think you can see the definite push from the Caribbean and the impact we've had on putting this on the agenda at the UN. I think further than that, we have to work on the details. And one of the things that we're doing here this time is reiterating the childhood obesity and obesity in general as the major pusher of NCDs, and that needs to be on the agenda also and stay on the agenda for 2012, and also to include physical activity. I think two things that were kind of weak or left out at the World Health Organization's level, and I think that's what we need to keep pushing. So we need to keep pushing that those details get included, because those are two I think parts that cannot be left out. I think the call to action really takes into account what Brazil is doing, what Colombia is doing, what Mexico is doing with the schools, and looks at the best practices in our continent, from Canada, also from the United States and the Caribbean, and looks at how we can change the environment around the individual. And I think that's the talk we need to have. We also need to be multi-sectorial, meaning including different partners. We've included in the Congress that we had in Aruba, the PACO, we had included there the media as a participant, not as just the media, and to kind of analyze why our message coming out from public health, from worldwide, is so weak compared to the industry's message, which a lot of times for fast food and drinks and stuff is much more powerful. And we're looking at how we can change that. I think with these new partnerships with infrastructure and trade and agriculture coming into the game, and education also, of course, and many more new partners, I think we can really make a big impact. I think one of the big impacts also is e-health. E-health is something we're focusing on. I have to say, and I'm glad to say, that Aruba is one of the first countries to have all primary health care, so all our house doctors are on an electronic dossier, an electronic file system, which can be then viewed. And I think that is a massive improvement in the primary health care, because we can really analyze the data as a public health standpoint, create a new compass, kind of, in other words, and analyze the data coming in and really give direction to our cure and care. I think the second part that we need to look at is in our cure and care, how can we work as small islands with countries like the United States? We're working with Florida, Baptist Health of South Florida. We're working with different institutions in the Netherlands to really do e-medicine and do it on the island, which means that our physicians can do more because they're being backed up by a specialist or a super specialist in one of the big countries, and work together on the patient. So aftercare on the patient and care can happen more on the island than it's now. If we take Aruba, for instance, we have patients that we send out to Colombia for treatment at about $1 million a month, which accumulates to over 13 million a year. If we can back off of those funds and be able to save some money there, I think we can reinvest in prevention. I think one of the other things that we're looking at is really self-care and promoting that. And how do you do that? Well, we have a couple of examples. We're using a company, Drimpy, which created a Facebook for healthcare that we can do on the phone also, but it really gets people connected to the hospitals, to the healthcare professionals, for questions that they have. Just on, especially people with chronic diseases that have these questions, they don't have to go all the way to the doctor and burden the system, but can get questions very easily. So we're working on that part of e-care. And the other part of e-care also in the same concept is the new food guide. In Aruba, we've created the sailboat food guide, which has been very popular with the kids. And what we've done with the sailboat is really put the power of play in it, animated it, and we're creating a new gaming platform. And this gaming platform really attracts the kids. They're able to go from level 1 to level 30 without anyone helping them and really learn about healthcare systems. And I think it's applicable for telephone. So, it's compatible to like the game Crazy Angry Birds. And so it's the same concept all the way to your computer, so a full game, and also to school grades 1 to 6 and high school, in where the professor or the school can actually have a full curriculum built around it. And this is really good use of your symbol, your pyramid or your plate, or in our case, our sailboat. And I think this is it's an innovative concept that we're working on, and that you will see in a second, how we're moving to this level and how the kids are reacting to it. Because if you start attacking the problem of NCDs and you look at the major pusher of NCDs, which is obesity and childhood obesity, the focus needs to be there. And then you need to take a life course approach, which means you go all the way from when mom thinks she's going to get pregnant all the way through life, and look at where we can come in and really change the environment to give us the biggest impact. And we're seeing that the first years of life, including the pregnancy period, are the most vital times to really introduce the new lifestyle and also the change in environment. Well, I'm glad to be here. I think together with PAHO, we created the first PACO event, which was last year, June, which was a huge success and ended up us the paper in the UN high-level meeting. And I think what we need to do is continue in that, and we want to push that and stress that. So we will be introducing a push that in 2012, obesity, and specifically childhood obesity, stays at top of the agenda. And at the same time that we have PACO 2, the event in Aruba, June 12th to 16th, to all the countries to participate again, and all the different ministers. We've had the last one. We've had 22 countries with different ministers from really integrative group that came together and really produced this paper with a lot of scientists. And we hope to expand that even more with focus on physical activity, focus on e-medicine, M-health, and really looking at the benefits that this could give to the small island nations and also the countries that are struggling. I mean, if you look at countries like Brazil, Chile, Argentina, Colombia, Venezuela, in the outer skirts of these cities, beyond the cities, e-health becomes a great tool that can be used.